Well, did you know that postpartum depression is the most common medical complication of childbirth? According to our next guest, the results of a new study potentially represents a major step forward for women with the condition. Dr. Samantha Meltzer-Brody knows quite a bit about this subject. Welcome to the show, and let's get right into this. What is, for those who may not know about this, what is postpartum depression, and how does it affect the mother and the family?
So postpartum depression is one of the most common medical complications of childbirth. It impacts 1 in 8 women, and it can cause really devastating outcomes for mom, baby, and family. So the mother may feel sad, blue, down, anxious, difficulty concentrating, not able to sleep even when the baby's sleeping, may have suicidal thoughts, which is terribly concerning. Importantly, it can cause difficulty with mother-baby bonding, and this can cause long-term negative outcomes for the child over the course of the child's life. So it's so important that it is diagnosed and effectively treated.
I want you to go over kind of some of the physical signs and symptoms again, real quick, because I think that's important for loved ones to what to look for in the mom after childbirth.
Right. So all new moms, and if it's a second or third baby, the postpartum time is a great transition time. People are exhausted after childbirth. The first 2 weeks, there may be more sort of emotional tearfulness. That's often called the baby blues. But if symptoms persist or are severe, then that is called postpartum depression. It is a depressive illness and requires treatment. So again, women may feel sad, blue, anxious. Suicidal thoughts are the most common cause of maternal mortality if someone becomes suicidal and takes their own life, which is obviously terrifying. So it's something that we really want all women to be screened for and treated.
I mean, you mentioned it there. It's obvious to see why it's so important for women to talk to their doctors. If you can't talk to your family, at least talk to a doctor, right?
Absolutely. So all women ideally should be screened routinely in the postpartum period. But if your doctor doesn't ask you about it, it's really important for all women to come forward if anyone's having symptoms they're concerned about and say, I know postpartum depression is common, I want to be screened for this, or I'm having these symptoms. There is no shame, there should be no guilt. It's not anyone's fault if someone has this. It is, again, one of the most common complications affecting 1 in 8 moms who give birth.
What's the current treatment methods?
So current treatments include psychotherapy, talk therapy for mild, moderate symptoms. There's been antidepressants, general antidepressants like the SSRIs that have been used for many years. They can take 4 to 6 weeks to work, but can be helpful for some women. And then I'm here today talking partly because of a new study, a series of clinical trials that were conducted. I've been the academic investigator, and these studies have looked at an investigational medication called brexanolone, which was specifically developed for postpartum depression and was recently published in a peer-reviewed journal called The Lancet.
So this new drug, what's the significance of it and about the results from it?
So the drug is currently under review by the FDA with a decision expected by the end of December. Brexanolone works rapidly, and so you see relief of symptoms starting within 24 hours of receiving the medication. It is a 60-hour injection. So a woman receives a 60-hour injection and then is followed in the studies to date for 30 days afterwards. And the results have been really exciting in that the majority of women had a rapid onset of response. Response was maintained over the 30 days. So we're seeing this as potentially an exciting new tool and a very different way of treating postpartum depression.
And a special thanks to Sage Therapeutics for bringing us that information. All right.